Welcome back to TV5 News at 9. Today we are talking with board-certified neurosurgeon, Dr. Jagannathan. Thank you so much for being here. We're delighted to have you, Dr. J.
Thanks, Colette. Thanks for having us.
Of course, you're welcome. So we're talking about lumbar stenosis. Tell us a little bit about what that is, Dr. J.
So lumbar stenosis just means narrowing along the nerves, along the spinal canal and the lower back. It can be caused by a variety of reasons, including discs that are bulging or herniating on discs, on nerves from arthritis or buildup of bone spurs around the nerves. Less common causes, such as a traumatic injury, a fracture can cause it, and in severe cases, even cancer can invade the spinal canal and cause stenosis.
Now, what would someone say, oh my gosh, this could be lumbar stenosis? How would they know? What are the symptoms?
So the symptoms can vary, and oftentimes they're not extremely specific. I mean, the classic symptoms patients have, especially older patients when it develops through arthritis, is pain that tends to be worse when walking. It's called claudication, which means leg pain that tends to be worse. And classically, patients like that have pain when they're walking long distances, and when they stop or when they lean against a shopping cart, when they stretch the back, usually that pain gets better because it creates more room for the nerves. In other cases, it can be things that are more innocuous, just generalized back pain, numbness or tingling in the legs. In severe cases, it can cause problems of balance or weakness in the legs as well.
Okay, great, Dr. J. We'll get back with you in just a bit. Also with us this morning, patient Michael Nowicki. Thank you so much for being here today, Michael.
Welcome.
Now, Michael, you went through this treatment for lumbar stenosis. Tell us about what your symptoms are and what they were, and when you realized that, hey, something's wrong.
When I first noticed what was going on was that my feet were tingly, and then it started going up my leg, my left leg, and then that I tried everything. I tried a leave to build the pain a little bit, and then I tried going to the chiropractor. I tried that for a while. And then I tried a little bit of exercises, and nothing seemed to really work. And then this one time I was cutting grass. I like to do a lot of yard work and that. And it came to the point where the numbness in my left leg, it got to the point where I started losing my balance. And then I said, oh, this is like the end of the road. I got it back with the doctor, and I can do about it, do like surgery.
Wow, Michael, it seems like you have just gone through quite a bit with that. So then you said you decided on surgery. Tell us about your process. How was that for you?
It worked pretty good. I think it's about 85-90% a success rate. That I'm feeling really good right now. The Dr. J wants me to do a lot of exercises, a lot of walking, and like setups and that, but I want me to just a little bit at a time, every day.
Right. Now, Michael, when people are deciding this and they hear, okay, I'm going to have surgery, they want to know, how's the recovery going to be? So tell us how you're feeling now and how your recovery process is going for you.
I would say if you feel that you need surgery, that I would go ahead with it, because there's no sense of feeling pain in your body, and that's how that I felt that I didn't have any choice in the matter. I tried everything,
right, and
that I seen Dr. J's commercial on TV5. It was about 7 months ago. Actually, that's how that I found Dr. J was on TV5, and then I went to his office, and then they went through all the procedures, and I'm really glad that I did.
Oh, Michael, we are so happy to hear that you are feeling better and that you're recovering well. Thank you so much for joining us and taking us on this journey with you today. Thank you.
Welcome.
Now, Dr. J, back to you. What advancements would you say, Dr. J, have been made in treating lumbar stenosis?
So the surgery for lumbar stenosis, even though the goal is exactly the same as what it was 20 or 30 years ago, the trend has gone towards having smaller incisions and quicker recovery times. And what people are noticing is that the traditionally extremely large fusions that were done resulted in extremely long hospital stays, a lot of blood loss, a lot of pain, and a lot of times the morbidity, the treatment in some cases was worse than the actual disease. And so with advanced imaging, we streamline the incision. We do a smaller incision and focus on cleaning up the area where the narrowing is. But at the same time, really emphasizing ambulation, as Mr. Nowicki mentioned, and recovery, because at the end of the day, that's what we want. We want patients to be active and getting their lives back to normal as quickly as possible.
That's right. That's the big goal, of course, after surgery. And tell us, Dr. J, how can someone learn more? I know you've piqued a lot of people's interest.
Yep, you can visit our website, www.mi-neurosurgery.com, or call our office number at 989-701-2538. We have a new office in Bay City as well, where we'd be happy to see you.
Sounds good. Thank you, Dr. J. Thank you so much for joining us today with this valuable information. We appreciate it.
Thank you.
Okay, you're welcome. And you can find more information in the hot link section of WNEM.com.